So, Dr. Mugda, we have one more query where people are asking that miscarriages is very common problem nowadays. So, could you please highlight what could be the reasons for this?
Yes, okay. So see, the commonest, all the reasons for miscarriage, let us enumerate. Uh, we look at genetic causes. So genetic cause, if there is a genetic problem in the parents or in the embryo. The second, we look at anatomic or structural. That is whether the uterus has any, say, fibroids, septum, polyp, or whether it has any other unicornate uterus. So these are the things which could increase the chances of miscarriage. Also, there could be defects in the sperm. So you have to remember that also. The sperms are equally important. Structurally, when we say only, it's not only the uterus, it's even the sperms. Then we look at the third cause is the hormonal causes. The hormonal causes are like if you have uncontrolled hypothyroidism, or your prolactin hormone is high, or if you have polycystic ovaries, then the chances of uh, miscarriage or even IVF failure increases. The next cause which we look at is any infections. Now, infections are mainly rubella is something rubella viral infection can cause. And yes, tuberculosis of the uterus can definitely cause IVF failures or even miscarriages. The next which we look at is any systemic disorder, metabolic we say, means uncontrolled agar diabetes hai, uncontrolled hypertension hai. See, if it is controlled, a woman can carry the pregnancy. But if it is
Right.
uncontrolled, then it will result in a miscarriage or a IVF failure because the blood supply to the uterus gets compromised. Now, the next factor which we look at is any clotting disorders. We call thrombophilias. Thrombophilias can be congenital, means by birth, which are quite rare, but also there can be acquired. Now, these thrombophilias cause excessive clotting of the blood. So the blood vessels to the pregnancy itself are so narrow. कि if there is clots formed in it, then the pregnancy will not grow properly. So if there is a thrombophilic disorder, the chance of miscarriage definitely increases. So these are the causes which account for about 40% of the cases, and the remaining 50 to 60% of the cases which are called so-called unexplained, are mainly immunological rejection of the pregnancy. So what we are talking about lymphocyte immunization therapy is testing for is alloimmune rejection of pregnancy, because any pregnancy is 50% mother and 50% father. So
Right.
50% of the father's genetic material is foreign to a mother's body. And we all know that our body doesn't accept, हमें कुछ भी foreign accept नहीं करती. Like it will not accept any infection. It will not accept mismatched blood transfusion, liver transplant, kidney transplant. But pregnancy is one thing which the immune system treats differently from the rest of the body. So as soon as the pregnancy enters the uterus, there are certain blocking antibodies which cover the uterus and do not allow the immune system to come and attach to the uterus. This is called as immune tolerance.
Tol-
And plus, there are T regulatory cells which help in the immune. They tell the immune system, यहाँ पे मत आना, इधर हाथ नहीं लगाना, and the pregnancy grows to term. Now, in some patients, this immune protection is not formed. So these are the cases where we test them with all the tests like lymphocyte cross match, natural killer cells, TNF alpha, anti-thyroid antibodies, and we come to a diagnosis whether alloimmune rejection of the pregnancy exists or no.
Okay.
So
Right.
these are the causes we can say of miscarriages and IVF failures also, because there has been a recent paper, it's published in the Austin Journal, where they have said that uh, the causes of IVF failure and miscarriage are the same. They have proved that because all the causes which are responsible for miscarriages can also cause IVF failures.
Okay. So we cannot discriminate like
Yeah.
ये है तो इस वजह से हो गया और ये वाला रीजन ये नेचुरल प्रेगनेंसी इसलिए खराब हो गई. So
हाँ
the
हाँ.
reasons, right.
And sometimes all factors can coexist also. So that's why we are trying to spread the awareness that try to think about this early.
Right.
Don't wait for a very long time to allow them for 4 or 5 failures, and then you think after 2 failures itself. Start investigation at the second failure itself, where you look at the genetic and all other investigations.
Right.
So this is I yeah.
So I think this is the right approach, because हम बहुत साल, I would say that many years we waste just because कि try it will happen. I know लोग भी यही कहते हैं कि try you will succeed. This is like a very common thing. But यहाँ try के बीच में थोड़ा रुकिए, थोड़ा इन्वेस्टिगेशन कीजिए, देन अगेन ट्राई, एंड वी बिलीव कि रिजल्ट जरूर आएगा. So, Dr.